Yeah, come on in.
Hi, how are you doing today?
I need help. I can't breathe.
Oh no, I'm sorry to hear that. My name's Blair. I'm going to be your student nurse today.
All right, Blair, just help me. I don't care who you are.
Can you do me a favor and please verify your name and date of birth?
Yeah, it's a Phyllis McCracken, 317XX.
Okay, thank you, Phyllis, so much. I'm going to go ahead and get this started off by raising the bed. And you said you were having trouble breathing, was that right?
Yeah, you can't tell? Look at me.
Oh, it does look like you are a little discolored, so let me finish raising this bed. I'm going to go ahead and tilt the head of the bed up to help promote oxygenation.
Oh, that's a little better.
All right.
But still, I need help.
I know. I'm going to do a quick assessment of your lungs, so if you don't mind, I'm going to go ahead and listen to your lung sounds.
Okay.
I'm going to provide for privacy. Breath, 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 breath. All right, and now on the back side. Deep breath, deep breath, deep breath, deep breath, deep breath, deep breath. Okay, the lung sounds are a little diminished. I'm gonna go ahead and put this pulse ox.
I'm gonna die.
I'm gonna put this pulse ox on your finger, and then I'm gonna count the respirations. So just go ahead and lay relaxed. Counting for a minute, we have 22 respirations in that minute, and the pulse ox reading is at a 92. So we have a doctor's orders to administer 2 liters of oxygen per nasal cannula. So I'm gonna go ahead and assess behind your ears and make sure there's no lesions or cuts. Everything looks good. And now I'm gonna go ahead and administer that oxygen to you, so hopefully you start feeling like you're able to breathe better.
Oh, yes, please. I've had that before and it helped extraordinarily.
Okay, awesome. All right. So this is gonna go in your nose. It might be a little uncomfortable at first, but you will get used to it.
It's really uncomfortable, and I know it's gonna help me breathe.
It will. Okay, and then I'm gonna set this to 2 liters per the doctor order.
Oh, I can feel it.
Awesome, that's what we like to hear. I'm gonna go ahead and change my gloves so I can do an assessment of your stomach. Per doctor's orders, we also have a wound change.
Okay. I haven't changed that in weeks.
Oh no, I'm sorry to hear that.
Seems like you're the only good nurse in this whole hospital.
I don't think that's true. I think there's a lot of excellent nurses.
Well, I don't know about that. I'm complaining about not being able to breathe all night.
I'm sorry for that, Phyllis. Okay, so looking at it, I don't see any signs of redness, any lesions, any sores. I'm gonna go ahead and listen to the bell sounds in all 4 quadrants. I have normal bowel sounds, and now I'm gonna lightly palpate the area. Do you have any pain or discomfort when I'm doing that?
No, not at all.
Okay, perfect. So now we can go ahead and get this dressing changed for you. Let me just set up my equipment really quick. And I'm gonna place this bag. It's just where we're gonna discard your old bandage. It is brand new. Is that all right with you if I set that there?
Yeah, that's all right.
Okay, thank you so much. Right, let me get my tape out.
Well, look at you, you're so prepared.
You gotta be in this business.
Just be gentle taking that tape off.
I promise I will. And if you feel like I'm tugging too hard, just go ahead and let me know.
Oh, I didn't even feel that.
Okay, awesome. And I don't see any drainage. Everything looks clear, so that is a good sign. Go ahead and change my gloves. Okay, and I'm gonna start by putting the drain cover over. And then a gauze 1, gauze 2, and then finally the bandage. All right, and then I'm just gonna go ahead and tape this down for you. All right, now that we got that dressing reassessed, I'm gonna get this out of here and I'm gonna go ahead and reassess your lung sounds. And I will document that later. Phyllis, and since I was the last one to change your bandage, I'm just gonna write my name and the date so your next nurse knows when this was last changed so we can hopefully keep up with changing it on time and accurately. Okay, and now I'm going to reassess the lung sounds. Deep breath, deep breath, deep breath, deep breath, deep breath, deep breath. All right, and then again on the back. Breath, 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 and breath. Okay, your lungs are sounding a little bit stronger, and it looks like we'll reassess the O2. And while we're doing that, I'm gonna go ahead and just assess the abdomen again. All right, it doesn't look like there is any distension, so that is good. I don't see any leakage from the new dressing. And if I palpate the area, just let me know if you experience any pain that wasn't there before.
That feels the same.
All right, perfect. Now I'm gonna go ahead and, per the doctor order, we need to take a specimen collection. Okay, so I'm gonna go ahead and open this, clean both ports, drain, and then we want to squeeze it while we re-plug. All right, cover you back up. Remove my gloves. Clean my hands. All right, and how are you feeling, Phyllis?
Oh, I feel a lot better.
All right, perfect. So I'm gonna go ahead and put your bed back down to normal. I want to thank you for letting me help you out today with these doctor's orders. Was there anything else I can assist you with before I leave?
No, Blair, that's all. You really saved my life.
Well, I'm glad I could help you today. Here is your call light, and on this table is your water. So just go ahead and push the button if you need anything. We'll be back to check on you in about 30 minutes. So provide privacy. Wash my hands.